Definitely you heard about coronavirus. So let's talk about the situational and epidemiological analysis pandemic COVID-19 in Pakistan. What is the role of FDA and WHO in all this pandemic, and why we didn't find solution up to now? Hi, my name is Yaul. I'm from engineering first 4 semester from International Medical University. So the purpose of our study was to investigate the epidemiological situation of the control of COVID-19 in Pakistan and to identify the objectives of further research to identify the true causes of the wave-like appearance of flashes of this disease. We collected data from different websites, from official websites and research journals, then analyzed for the disease prevalence, epidemiology, mortality rate, and recoveries. So the result indicated that the rapid increase had indeed occurred in the number of COVID-19 infection in Pakistan and continuing in wave-like appearance. It is a report of 30 January 2020 that the World Health Organization declared coronavirus outbreak as the sixth public health emergency of international concern. And on March 11, 2020, the World Health Organization announced coronavirus as a pandemic. Coronavirus started to be increasing in Pakistan. The first case of coronavirus was reported from Karachi on February 26, 2020. It was estimated population of Pakistan as 2.65 million. Students which had just come from Iran and another in the Islamic territory. Successively, the virus spread into various regions nationwide and had currently become as a pandemic. So the World Health Organization had warned Pakistan that the country could encounter great challenges against the outbreak of the coronavirus in the coming days. In this graph, you can see here the death rates, the confirmed cases, and the tests performed. We are going to show you here the graphical representation of the death rates, confirmed cases, and the tests performed in all over the Pakistan. So the blue line represents here the test performed, while the brown you can see here the confirmed cases. So as we can see from the graph, the peak of disease was from June to July of 2020, and a wave-like outbreak of the disease continues unless today. This blue line here represents the active cases in all over the country. As you can see from the graph there, the peak was established on the previous year 2020 in June. While in this year, if you talk about 2021, so the peak is in April. This graph represents here the daily new cases. So as we can see from the graph, the disease goes to peak in July 2020, despite the fact that there is no shortage of drugs and doctors have learned the methods of treating coronavirus. In June 2020, the cases goes to peak and then descend down, and once again in January of 2021, 21st, goes to a little peak, crosses nearly the 3K cases. And once again in April 15 and onward, we have a abundance of cases, like more than 157 cases were recorded on a single day. This graph represents here the daily deaths rate. So the peak of the detail is currently repeating the peak of the deaths in July 2020, despite the fact that there is no shortage of drugs and doctors have learned the methods of treating coronaviruses. Here you can see simply in the graph data, the peak was present previously, if you talk about 2020 in June, and once again in April, we have a lot in abundance of death rate, which recorded more than 157 cases in a single day. This graph represents here the death rate per day. So at the beginning of this year, we can see we have the least number of cases, lowest number we have a lowest number 2 or 3 cases recorded per day, while the greater amount here, we can see 157 cases which were recorded in the April 2021. This graph is a mutual comparison between the new cases and the recovery rates. So as we can see clearly that the blue represents here the new recoveries rate and the brown represents here the new cases. So the recovery rate in Pakistan is much greater than the new cases, which is confirmed and established between each day. So the new recoveries rate are much greater. Recovery rates in July 2020, if you talk about data, so we have abundance of new cases. So on that day, previously we have a much more recoveries rate as well. This graph represents here a continuously increasing order of the total cases in Pakistan. As we can see from the graph data, the COVID-19 is growing, and in the time confirmed cases 7,95,677 in Pakistan, and graph is continuously growing up and in ascending order. This graph represents here the total cases, total deaths in Pakistan. Like we have 17,117 deaths up to April 15, 2021. This is a map-wise distribution of the province bases. Like we have Azad, Jammu Kashmir, Balochistan, Gilgit-Baltistan, Islamabad, KPK, and Punjab and Sindh. The least number of cases recorded in the Gilgit-Baltistan, which is 5,253, while we have active cases of 109, and the deaths rate are 104, and we have a recovery rate of 5,040. So here you can see the total cases, confirmed cases, the active cases, the deaths rate, and the recoveries rate. Well, Punjab, we have a more and greatest number of confirmed cases and the deaths rate, and because population-wise, it is the biggest province of Pakistan. Conclusion. The conclusion of our research found many questions, as why outbreak of COVID-19 happens undulating. Why last year the peak disease was in early July this year, and already in April, we talk about 2021. So which factor really affect the spread of this disease and this infectious disease, and all those questions promoted for this study, and we will continue our research. Here are the references through which we collected data from the official websites like WHO, FDA, Government of Pakistan, Ministry of Training, under the supervision of our high qualified PhD scholars and our respected teachers. So why we can't find solution up to now? It's our last question. Because of the drug we use have some side effect, and the different categories of the patient we have, like some patient have age less than 20, while they have greater than 50. So the patient which have greater than 50, so they also have some other kind of disease like diabetes and heart problem. So a single dose can't implement fully on it, and we can't achieve our aim, and we can't find solution to now. So that's it. Thanks for your attention. Thank you.